All right, everyone, welcome back to the show. We have a very important topic to tell you about right now with Dr. Paul Tung. He's joining me from RadNet. He's a radiologist. He's been there since 2016, right, Doctor?
Correct.
Yes. Well, you are here with us today to talk about the importance of prostate screening. Welcome to the show.
Thank you for having me.
It's very nice to have you here. I know that this is such an important topic. Why is EPS, it's an acronym, I'll let you tell our viewers what that is. Why is it so important for men?
Well, EPS stands for Enhanced Prostate Screening, and it's a program developed by RadNet where we use non-contrast MRI to detect prostate cancer with assistance of artificial intelligence. And it's important because about 13% of American men will get prostate cancer during their lifetime. And
Wow.
about 2 to 3% of these men will end up dying from prostate cancer. So it's just something that we want to educate the community
Sure.
about the importance of prostate screening and early prostate cancer detection.
Dr. Tung, is there an age where you recommend that men start getting screened?
Yes, typically, if for men at average risk, meaning that there's not a strong family history of prostate cancer, typically these populations should start screening for prostate cancer at around age 50, and typically that's done with a simple blood work of PSA levels,
Mhm.
and that's where it usually starts. And however, for certain subsets of population, we recommend prostate cancer screening starts at age 45. For example, for many African American men,
Is that
they are
right?
actually at a higher risk of developing prostate cancer.
Hmm.
And so we're recommending them to start screening at age 45. And also, you may have patients with a stronger family history where their first degree relative had prostate cancer at an early age. We recommend them to start at age 40.
I understand. Wow. So what are those types of genetics that are playing into it, especially with the African American culture? Do we have any idea what causes them to be more at risk at a younger age?
We're not really sure the exact cause of that. It's just that in the general population for cancer detection, that's what we have found so far is that they are at a higher risk. It could be some underlying genetic predisposition, or it just for other could be lifestyle or environmental factors as well.
Right. So that was going to be my next question. So are there environmental risk factors that are contributed to prostate disease?
Well, the most common risk factor for prostate cancer is age, actually. So as men get older, their risk of developing prostate cancer increases. Of course, that along with family history, like we discussed, race and ethnicity. Certain subset of population are more predisposed to developing prostate cancer. But specifically as to why we don't really have that elucidated at this point.
And Dr. Tung, do you know or are you aware of what are the environmental factors that are playing into this?
Some of the environmental factors could be, uh, chemical exposure, smoking, uh, dietary changes, for like high fat, high cholesterol diet that may have something to do with it. But also, they're just environmentally, if you are exposed, chronic exposure to certain, low level toxins and things that just in our environment that will also predispose you to develop prostate cancer later on.
Right. So it's important to eat clean, healthy.
Yeah.
Are there any symptoms that show themselves for men to look out for or be aware of?
Not specifically to prostate cancer, but for prostate, if patients are having non-specific pain in the pelvic area, blood in the urine, or trouble urinating, those are all signs of pointing to that you may have certain prostate disease.
Mhm.
It could be benign hypertrophy of the prostate, it could be prostate infection, or it could be prostate cancer. So definitely need the medical attention and search, get a doctor's appointment to further investigate.
So if somebody's been diagnosed with any type of prostate disease, I understand there's, quite a few. What is the prognosis and what's the treatment?
Well, if it's for example, prostate infection that's usually being treated with antibiotics. You see your urologist, a specialist, and they will usually manage the prostate symptoms if you're having enlarged prostate. There are different treatments that could possibly shrink the prostate volume so the patient can, have some symptomatic relief. Um, but for prostate cancer specifically, there are different treatment options for prostate cancer as well.
And so those would be just called out by the specialist who the patient is seeing.
Yes, they would tailor the treatment options of the prostate cancer based on the type of cancer, where it is, or the grade of the cancer.
Right.
For example, for low-grade cancer in a small area, sometimes active surveillance may basically means that you just watch and wait may be enough to monitor this cancer, make sure that it doesn't, progress. So we could just actively monitor via imaging and PSA levels. Uh, Higher grade cancers, then certain treatment options are uh, surgery, such as prostatectomy, just basically have the entire prostate removed. You can have radiation therapy targeting the prostate, or you could have ablation therapy involving using of ultrasound, such as HIFU or TULSA, to actually use a high frequency ultrasound to burn off the prostate cancer cells.
Really?
And then there's also hormone therapy as well.
So hormones are definitely playing a factor into the
Into
prostate,
the
just
prostate
like they do
cancer and the growth of the tumors, yes.
yes. Wow. How often are you recommending men get screened?
Well, it should be an annual screening at least. Uh, it could be with a PSA levels, or it just could be with a non-contrast imaging of the prostate, because with PSA levels, there are many factors as well that could change the PSA levels. Uh, for example, if you have an enlarged prostate, that could elevate your PSA levels. If you have prostate infection, that could elevate your PSA levels. And also sometimes a prostate cancer uh, will present with normal PSA levels as well, especially in patients that who also has prostatitis or enlarged prostate. So the elevated prostate levels may be masked by the fact that there's an enlarged prostate or prostatitis, and so imaging detections also has an important role in detecting prostate cancer.
Wow. Very important information, Dr. Tung, and we are certainly grateful that you were able to come on the show today and explain the importance of prostate screening. Appreciate you being here.
Yeah, thank you.
Thank you so much. You're watching This Day on Village TV. We'll be back after these messages.